Hello, and welcome to Island Health's instructional video on techniques for caregivers to don clients' compression stockings. Always complete a point-of-care risk assessment prior to any patient handling care. This assessment may be displayed like this on any paperwork or care plan. Let's start by reminding you that the manufacturers recommend removing any hand or wrist jewelry you are wearing and to use form-fitting gloves. This minimizes the risk of damaging the stocking and making the task easier to perform. Equally important is to prepare yourself to assist the client. You want to minimize awkward positions such as slouching your back or extended reaching. We recommend you sitting on a stool versus squatting down or slouching. And position yourself close to the client to minimize reaching at arm's length. Let us begin by reviewing donning a compression stocking as a caregiver. Applying a stocking can be easier with the use of these specialized gloves. Insert over the foot, then gently remove your fingers out of the stocking. Grasp the top side of the stocking and begin to turn right side in as you begin to fit it up the leg. With the sock now on and over the heel, if possible have client lower elevated leg and move yourself closer. When complete, the top of the stocking should be about 2 finger widths below the bend in the knee with all wrinkles removed. If the client requires more assistance, we will review some of the common aids used to don compression stockings. In this video, we will demonstrate how to use the Magnide on and off device to don a compression stocking. Smooth the material and grasp the top strap and attach to its corresponding magnet as seen here. Applying a stocking can be easier with the use of these specialized gloves. It is now ready to place over the foot with the top strap placed up near the knee. The next step is to pull the drawstring taut. Now pull the stocking over the foot, removing any wrinkles, and make sure the heel portion is aligned with the heel of the foot. Note the caregiver paused the procedure and smartly requested the client reposition her leg to make it easier for the caregiver to continue with donning the stocking. Have the client assist as much as possible. The final step is to take hold of the strap and pull towards you. The magnets will release and will easily allow you to remove it. A final check is to ensure the top of the stocking is about 2 finger widths below the bend in the knee. Let's observe from a different angle. Now, let's take a look at the Truform stocking donner. In this scenario, instruct the client to complete the following steps. Using the slip-on cage, place the stocking into the frame with the sock's heel facing into the cage and the foot of the stocking facing the base. Now place the stocking over the half-circle top and slide the stocking down the frame until the heel of the sock reaches the top. Have the client take the cage with the stocking on it and place by their foot. Cue them to hold the handles, then gently and slowly step into the stocking and pull the cage upwards while pushing their foot down. Also, cue them to push their foot away from the cage to ensure stocking remains tight. Have the client pull up the stocking up the leg about 2/3, then remove the butler and continue to pull the stocking to about 2 finger widths under their knee. Now, let's take a look at the Steve's original complete model donner and doffer. This device can assist client with reduced ankle, knee, or hip range of motion. Have client wear sticky gloves and place the stocking on the device with the heel facing them. Stretch the stocking over the central frame all the way to the heel pocket, making sure the stocking's heel is facing the back of the donor. From a secure seated position, cue them to place a foot into the stocking. Now cue the client to grab the handles and gently pull it up the leg. The top of the stocking should end about 2 fingers width below the bend in the knee. Cue the client to remove the butler and smooth out the stocking to remove any wrinkles. Finally, let's take a look at the Sigvari's sleeve to assist with stocking donning. Now, we will review a technique where the caregiver can apply a compression stocking. First, the caregiver applies the arm glove, then run your arm through the inside of the compression stocking as seen here. Now apply the donor up your arm to the end of the stocking, wrap the end of the stocking around the donor and then roll down your arm. Then reposition the stocking on the donor so that the heel portion is at the end of the donor. Place the donor on the front of the client's foot so that the heel is facing down and away from you and then roll up the leg. Then, remove the donor. Smooth out the stocking to remove any wrinkles. The top of the stocking should be about 2 finger widths below the bend in the knee. Thank you for watching. For more videos like this, check out our YouTube channel.